This is Bridging Health Care, and I am your host, Bridget. Thank you for joining me on this channel. The main focus is helping us to become highly effective healthcare worker, bringing informative, educative solutions to our world. I am so happy you're here. Sit down, relax, like, share, subscribe. Thank you. Hello guys, and welcome to my channel. This is Bridget from Bridging Healthcare. How have you been? Have you been following all the classes? All right, if you haven't, they are all there on the channel. The name of the channel is Bridging Healthcare, and on this channel we focus on giving you educative informations about how to be a highly efficient and effective healthcare worker. So sit down, relax. If you're still a student, this is your school. And if you're already working, the day you stop learning, you start dying. So we keep working every day to get better, right? All right, today we're going to talk about something that I have experienced. I've seen people, I've not experienced as an individual, but I've seen it in my course of practice, both as a nurse and as a healthcare professional. And it's a condition that is quite popular and it's quite common. So I'm just going to give us an overview information, and I hope that this helps us, because as a healthcare professional, you need to have an idea of disease conditions so that when you see symptoms in your clients, you won't be perturbed, right? Because you have an idea. And that is why we're here, to help simplify it. So you don't have to go and start breaking your head and reading all the books. You can just get some information from here, and it makes you highly effective and efficient. Today, we're going to be talking about prostate cancer. We're going to be talking about prostate cancer. Now, what is the prostate? That's the first question. Because when you hear a condition, it always talks, it's the name of the condition is supposed to let you understand what the problem is and where it is located. In the medical term, that is how names are formed. If you study nomenclature, that is how names are formed in the healthcare sector. So I'm going to talk about the prostate. The prostate is a walnut-sized, small gland that is located at the base of the penis, in front of the rectum. Now, if you form a male shape, so you're a male individual. Now, prostate cancer affects only men because women don't have a prostate, right? Good. So now it's just below the bladder, and it surrounds the urethra. Okay, so the tube-like channel that carries urine and semen is the urethra. Good. And it carries urine, semen through the penis outside the body. Now, the purpose of the prostate is to make seminal fluid. Yeah, the liquid in the semen that protects and supports and help transport sperm. That's the work of the prostate. The work of the prostate, which is this walnut-sized gland, its work is to help to produce liquid that is used to allow free flow of semen, which is also called sperm, for men, out of the penis. That's the work of the prostate. Now, as people age, the prostate continues to enlarge, and this can lead to a condition called hypertrophy of the prostate. Hypertrophy of the prostate. So hyper, big, trophy, growth of the prostate. And when this happens, remember, it is just around the urethra, right? The urethra carries both sperm and urine. It's a tube that goes outside, leading to the outer side of the penis. Now, imagine that something that is around it is just the size of a walnut, and it begins to grow. What happens to the urethra? The urethra begins to squeeze in and shrink because something is around his neck. Just imagine that somebody is choking someone. Yeah. and is choking it. So now, if this prostate undergoes or grows in the case of prostate hypertrophy, and of course, growth is multiplication of cells, right? And the cells are taken out and it's choking, of course, in both ways. Once it grows, the urethra is affected because urine will not be able to flow easily, right? It will be very painful for urine to flow. And sometimes when the choking is too tight, there can be brushing and bleeding can occur. Now, if this person has gone to the hospital to do a test and they do a flow rate test, which they always do in the hospital, and some other tests that is done like PSA levels and all that. When the test is done and they find out that the prostate is bigger than supposed to be, there's a range. They find out that the prostate is bigger than supposed to be. Now they need to take a sample of that prostate, of that enlarged prostate. They just cut out part of it, and it's not like a surgery thing. They just use a device through the rectum to get some of this out, and then this is taken for histology, which is called a test, a cell test, a culture. And then when it is tested, if there is a cancer growing in there, then it is now tagged as prostate cancer. Whatever stage of growth the cancer is. Remember, from one of our classes, we discussed that cancers are very greedy cells. They keep eating all the food that the healthy cells need to survive. So if there's a cancer there, that means the growth rate will be faster. So there is still hypertrophy, of course. And now there is cancer. And cancer is destructive, right? It will make sure that it starves all the cells that is healthy around and begin to grow, mutate into something that we don't understand. So, in this condition, if it has been certified that this person has got a cancer, then you've got problems on your hand. Even if it's hypertrophy, you've got problems on your hand. It can be treated, it can be corrected, but sometimes it is surgery, sometimes there are medications that are used to bring about shrinkage. So some of the tests that are done are prostate-specific antigen, PSA. They will check the PSA level if it is within the normal range, like I said. So what are some of the symptoms that this client will have? Of course, their prostate is enlarged, but it might not be something that you will see like that physically. But some of the things that you realize is that the person spends longer time in the toilet. So they want to make urine. Making urine can be very painful because, of course, what is supposed to pass the urine out is stifled, right? Making urine can be very painful, and sometimes the urine will come out in drops and they're not able to complete urination. So urinary tract infection can build because the urine now is going back into the bladder, or it's just in between, trapped in, and from there it means that you can have an infection because the urine that's supposed to come out has got toxins in it, and because the toxins are not getting out of the system, bacteria will grow on it. An infection will happen, definitely. So they will always suffer from urinary tract infection. And what are the symptoms of urinary tract infection? You'll find out that the person can be delusional, the person is having fevers, the person can be, just feeling of unwellness, general feeling of unwellness. The person can be in generalized body pain. The person will lose appetite and begin to lose weight, So those are some of the conditions that are attached to urinary tract infection. Also, that due to this cancer, there's an enlargement. So you will see that there's an enlargement, and sometimes it can even lead to an open wound. It can be anything. So when you have a client that has this prostate cancer, or however the situation is, they most likely will be on a catheter. They most likely will be catheterized so that urine can come out, so that this person doesn't keep having urinary tract infection, UTI. So that means that you must understand catheter care. You must understand when to drain the catheter. So there has to be draining at least 2 or 3 times a day, depending on, and of course they will encourage the person to keep drinking so that the bladder and the whole urinary system is working and there is flow. That way, the person is also protected. So if the person is catheterized, then your catheter care must be up to speed. You must always measure quantity of urine. You must always measure, and you must check urine if it is cloudy, if it has got blood stains in it. Those are the things you must record. Okay, and then you will check the person's disposition as well. Probably the person was happy yesterday, the person is not able to talk today, or the person is just irritated. You should note it down. These are things that once you see, you can be able to know, okay, this is what is going on. So prostate condition is a very popular, common disease condition found among men of between the age of 55 and above. Mostly, it doesn't mean that it doesn't affect younger people, but it's majorly in older people because the prostate begins to grow as we age. So as a healthcare professional, you need to be hands-on prepared to take care of your clients. That's why it's good to read your client's file, get an information about the person you're taking care of, know what's going on with them. If you know what's going on with them, you can you can firm up your skills in catheter care, and then you have to change if they are using an incontinence aid. You have to always ensure that it's clean. The environment have to be tidy. You have to clean. You have to do a proper catheter care, and you have to also give them good personal care. Very important. You have to wipe neat. Make sure that if you are cleaning the bottom, you are doing from back to front. Front to back, and not back to front. All these things will just prevent them from infection while they are on medication. And most times they go for surgery and they totally remove the prostate. So the healing process as well, you must also be able to know how to care for this client, most especially when you're giving personal care, and prostate cancer is very common. Is very, very common. And that is why, as a healthcare worker, you must know what it is. You just have a basic knowledge. I would like you to read further on prostate cancer. I think I will add some journals that you can go online and research on. It will help you to have an idea, because if you have to be highly efficient, if you have to be effective, if you want to be known as that person is exceptional, you must have an idea of what your client is going through. Thank you so much for always coming back to watch these videos, to listen to all I have to say. This is Bridget from Bridging Healthcare, and we are committed to ensuring that more highly efficient healthcare professionals are going out there to take care of people, to give them what they need, and to do the job properly. I hope this video has been able to help. Don't forget to like, share, comment, and let me know what you think about prostate cancer. I'm also open to learning. The day we stop learning, we start dying. Thank you so much. Bye.